I'm Larry HELWIG. I am the founder of CLEASKIN Institute in Phoenix, Arizona. Well, we started with our first one about maybe 5.5 years ago, and then shortly after that we needed a second one. So we have two of them, and they function almost all day, every day. Well, what's interesting about Scarlet is you can do full body, you can do face, full body. There's not any place on the body you can't treat very successfully. But we have a patient that we were really quite impressed with because she's 83 years old and she wanted her upper arms tightened, which can be challenging, at that age, and there was really quite a bit of laxity, which, you'd expect. And we did 5 treatments on her, and in 5 treatments her arms tightened up so well that it was just fun. I mean, she was so excited about it. She was telling her friends and showing her friends, things like that. So she became a great referral patient, and all we really did was treated her upper arms, and since then we've been treating pretty much her whole body. Well, what's so nice about Scarlet is it was created by Dr. Na, and the Dr. Na effect is really impressive, and that is how it delivers the energy versus all the other systems out there. And the energy comes to a fine point in the way the needle was developed, and so you have, in essence, a teardrop type shape. So the bulk of the energy goes down and out, and then it sort of comes up to a point in the epidermis. So the energy is where you want it. And this is without having to use any other method with it. This is a stripped down needle, and you're able to get results and comfort that you don't get from the other systems. And we had literally been given another system, and the staff, after so many months, said this is not working, we don't like it, and we gave it back. And then we purchased the Scarlet, our first Scarlet, and we've been very happy with it ever since, and our patients are happy as well. So it's a win-win situation for our practice. It's been a good referral type device, because if you think about it, anyone that's 45 and older has laxity. They start having fine lines and wrinkles. And so Scarlet does a number of things. It lifts and it tightens. So it's not just a tightening device. So by anchoring the tissue the right way, you're actually getting lift out of it. So whether you're doing eyelids or you're doing along the mandible and you're trying to bring that back, maybe it's the nasolabial folds that need some retraction. So if you anchor and your technique is proper, it is incredible. And then there's a second step to it, where you actually use a stamping technique, and that allows you to actually correct flaws in the tissue, like deep nasolabial. Maybe the corrugators up here, the 11s, things like that. You can actually go over necklace lines. You can actually go over and stamp, and so it's like a second treatment that you add to your first 2 passes that you do, and that second stamping technique changes the overall results dramatically. Yeah, we do recommend it all the time because it fits well with other technologies. So if you're doing a photofacial on someone, to follow with Scarlet is tremendous. If you're doing other treatments, so that's one thing that I think physicians, stacking your technologies, 1 + 1 = 3. So your outcome is so much better when you do that. So we highly recommend it to physicians because I think it works better. I think it's very safe. The profile is very safe. It generates great income for a practice, And most technicians can pick up on this very quickly. So it's delegatable. So that's the type of thing that I think every practice can benefit from.